After going to spin this morning, I don't know that I'm going to be able to sit for this entire recording because my legs hurt so much. When they were like, climb the hill, I was just like, no, thank you.
No, I'm good. Thank you, sir.
The music was great. I was ready to go back, but those hills, they destroyed me. So let's get started before my legs fall off my body. Rolling forward, Dr. Sister Science Facts. Welcome to this week's episode of Rolling Forward.
I'm Dr. Elise Rowland.
I'm Dr. Stephanie Rowland.
I'm a pediatrician.
I'm a psychiatrist.
And we are both part-time clinicians and part-time researchers.
And what we like to do here is talk about some topic that matters to families, present the evidence, and then let you come to your own conclusions about what's best for you.
So what are we talking about this week?
We're going to be talking about online platforms, social media use that help bring people together, but can also sometimes keep people apart.
Forward, Dr. Sister Science Facts. A lot of things have happened in the past week, and lots of phones have been lighting up with lots of alerts.
And those phones alerts may be the first time that we learn that a major crisis has happened. For me this week, it was when my phone went ding that I learned that Charlie Kirk had been assassinated.
In the midst of tragedy and violence that is all too common on our newsfeed, we wanted to take today to talk about what this means for our kids.
So in today's episode, we're going to talk about social media and violent content, because there is a lot of content out there. We're going to talk about how social media affects mental health in general. And then we're also going to provide some tips about managing social media use in your family. So let's get started.
Something that I found particularly fascinating is just the amount of violence that's present on social media platforms.
There is so much violent content out there, and social media is not monitored in the same way that legacy media, like news reports or newspapers, might be. And I remember when we were young, sitting at home and watching the tragic events of 9/11 unfold together on the television. And it was the two of us in the living room watching the news together and sharing that time as a family in our space as we were learning about these horrible events. And in contrast, this week, when Charlie Kirk was assassinated, people learned about that through alerts on their phones. And there are a number of kids who are watching video clips, hearing rumors, maybe a hot take on TikTok. And this is happening before any of the facts are confirmed, and often before parents even know what's happened.
And that really speaks to how phones are everywhere, social media is everywhere, at school, on the bus, late at night. Kids are learning about things in real time before it can be filtered through an adult, before facts are verified, before we can help kids understand what is happening. And that leads to parents and teachers asking the question, what's safe, what's harmful, and how do we manage cell phones, social media in 2025?
It's such a good question, and one that my family grapples with. There was a recent annual report from the Youth Endowment Fund, which is an organization that focuses on children in England and Wales. And it found that 60% of children reported seeing real violence on social media platforms within the past year. 60%. And this is not fictional violence, things like superheroes or cartoons. This is real violence, actual fights, use of weapons, and threats that kids are seeing within the past year on social media platforms.
And that's just staggering. This means that the majority of teens are watching violence. Like, it's not unusual. It's become part of daily life.
And so while we're thinking about it this week because of this high-profile tragedy, in actuality, kids are being exposed to violence constantly online. And one of the challenges is that the social media algorithms will often amplify violent content due to a high engagement rate.
Exposure to violence on social media can have profound effects on teens, including desensitizing young people to violence, normalizing aggressive behaviors, and in some cases, inciting retaliatory violence or inspiring other activities.
And young people are saying that they feel pressured to share and engage with violent content online.
So what does that mean for kids?
Alicia, psychologists call this the mean world effect, which is that the more violence you see online, the more dangerous the world feels. Even if your actual community is safe, you're seeing this really dangerous world and you start to feel like the world is much more dangerous than it is.
When tragedies happen, like what happened this week, like with many other recent shootings, information is available online. Kids are watching clips. They're watching the same clip over and over again. They're watching the same clip with people commenting on it, with different storylines layered on top of it. And that can leave them anxious, confused, mistrusting of adults who haven't seen what they've seen and haven't talked to them about what they're experiencing.
So this can lead to just a lot of misinformation and mistrust. And it's not just about violence. We know that social media affects kids' mental health overall.
This summer, a major study came out of JAMA, the Journal of the American Medical Association, that tracked over 4,000 kids for 4 years.
This was a fun study because it was actually by some of my former colleagues where they worked really hard to follow this large cohort of kids over an extended period of time to try to identify their trajectory of use, which essentially means people's pathways of using social media and phones.
They tracked how many minutes, hours you spent on your phone, and they tracked different markers of mental health.
And what they found was that kids who had more addictive trajectories or pathways where they were needing or wanting to engage with their phones and social media more and more, when it started to feel like their use was compulsive and getting in the way of school, friends, and family, that cohort with that pathway were at much higher risk for depression and suicidal thoughts.
And it's not just that one study. We've been seeing this over and over again in the science. A similar study from the University of California, San Francisco followed nearly 12,000 preteens and teens for several years. And they found that as teens increased their use of social media, they were more likely to report depressive symptoms.
And this study has a slight caveat to it, which is that they're not comparing heavy users versus light users. What they're looking at is within an individual person. As one person begins to use social media more and more, they're more likely to have depression in the near future after that.
What was particularly interesting is that depression didn't predict more scrolling. So having higher rates of depression on their markers didn't mean that you would use social media more, but the opposite was what they found. People using social media more and more were more likely to report depression.
And add to that findings from the WHO, which is the World Health Organization. They have found that it's problematic use, for example, using social media late at night, disrupting your sleep because of social media, the constant interruptions to your day. Those are the factors that really predict poor well-being, not just the raw hours of use. And I think this is important because I didn't have my first smartphone until I had graduated medical school and I was an adult. I was a doctor, and still it can be very difficult to put the phone down, turn it off, not worry about the alerts. So when we think about kids' brains that are still developing and they're getting these pings, 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 and there's this violent content and a pressure to share violent content, and then also what are people saying and sort of competitiveness of use and interfering with your day, it's not hard to understand why this might affect children's mental health.
But it's also not all bad. It's easy to demonize cell phones. It's easy to demonize social media and talk about the harms that it's having for health. But there actually also have been benefits.
For us, a family that immigrated, having social media now has been really helpful for staying in contact with our family in other countries, where we're able to be connected to our cousins and our aunts and uncles in a way that we couldn't when we were younger.
And social media allows kids who feel isolated to be a part of an online community of like-minded individuals. And this can save lives. Social media can help people feel like they're part of a community. And so, for example, for individuals that feel isolated, for kids that identify as part of the LGBTQ community, but live in a rural area, for people who live in communities where people don't look like them, online communities can be life-saving and can provide an outlet for like-minded individuals.
And that's why health authorities like the Surgeon General call out social media for both sides. There are risks, but there's also the possibility of connection.
So what can we do about all this?
Well, first, let's be careful. A lot of these studies are observational. We can't really randomize kids to using cell phones or not for 4 years, right? So that's not really a possible study design. And that means that these studies might show links, but they don't show perfect causation where one thing is causing another. The second thing is that we can't collapse this whole debate into phones are bad or phones are good. It's more nuanced than that, which is why it's important for families to come up with their own plans about monitoring social media and phone use.
So what are things that you can do at home to make sure that social media and cell phone usage can be helpful and not harmful for your kids?
The first thing is protecting sleep first. There should be no phones in bedrooms overnight, and we should really be aiming for 60 to 90 minutes of screen-free time before bed. We know that is best for allowing children to be able to get optimal sleep. And then, as we talked about in our back to school episode, it's good to keep a consistent wake-up time, even on weekends.
I think it's also important to ask your kids, what did you see online today? How did it make you feel? Did anything online worry you?
Starting a conversation is so critical, and this shouldn't be about surveillance. This should be about connection. Like you suggest, a simple, what did you see online today, can open up doors. And maybe it's a funny TikTok dance that they want to show you, or maybe it's violent content that they saw that is really bothering them, and you've opened the door for them to be able to talk about it.
It can be really hard when kids are telling you all sorts of wild things, but it's important to focus on listening and not lecturing.
And another important thing to focus on at home is media literacy. Helping your kids know that the first isn't the best. The reality is that rumors spread faster than facts. So if they're seeing something that is startling online, encourage them to wait for a verified source before believing what they see. And as always, it's important to think about red flags of social media use. The focus shouldn't be on minutes, how many minutes is someone using, but rather on the patterns. For example, is your kid using their phone in a way that's interfering with their sleep, their meals, or their friendships? Those are the things that we worry about.
Another concerning sign is when your child becomes really irritable, upset, when they're separated from their phone.
Or when the phone use starts to feel out of control and can't be cut back.
The other kind of big red flag that we notice is when kids have increasing social media use, increased phone times, that's happening at the same time as withdrawing from friends, withdrawing from family, and declining grades.
And parents shouldn't feel like they're alone in this. Schools are here to work with you too, with some schools recently switching to phone-free classrooms, having structured breaks where kids can use their phones. A number of schools are building media literacy education into either their health or their tech curriculum. And then a number of schools also have reporting channels for harmful content. If there is online bullying or other harmful content that is circulating, that there are people in the school to report it to. So our takeaway tips for parents, phones, it's a lot and they're not going away, but we shouldn't be focusing just about the time on the screen. We should be looking at the patterns of use, particularly patterns of addictive use. We should really be thinking about any sleep disruptions that are coming due to phone and social media, and then absolutely thinking about exposure to violence and harmful content online.
Just like for sleep, small shifts can make a big difference. Making small changes like moving the phone out of the bedroom asking one daily check-in questions. These small steps can really make a big difference.
Having a conversation with your child is going to be more helpful than having a ban. And the goal isn't to panic. There's a lot to panic about, but this isn't something that we want you to panic about. It's about having practical guardrails and starting this dialogue with your child.
Rolling forward, Dr. Sister Science Facts.
And that's our show for today.
If any of this resonated, please share it with a friend or a fellow parent. Review us online, leave us a comment. That will help other people find us.
You can always send us an email. Our email's rollinforwardshow, ROLIN_show@gmail.com.
And we are on the socials. So when you're using your phone and accessing social media, at least 60 to 90 minutes or more before bed, not interfering with meal time or sleep or parenting or work, you can find us on the socials.
Until next time.
Thanks for joining us.
Rolling forward, Dr. Sister Science.